"Get out of my trauma bay." The words cut through the organized chaos like a gunshot. Every conversation stopped. The trauma nurses froze. A first-year resident instinctively lowered the IV tubing he had been priming. Even the paramedics pushing the stretcher through the automatic emergency doors hesitated for a fraction of a second. Standing in the center of Trauma Bay 3, Claire Donovan didn't flinch. Her navy blue scrubs were spotless despite the pace of the afternoon. Blue nitrile gloves covered her hands. A trauma assessment clipboard rested lightly against her side. Her expression remained calm, almost unreadable. Across from her, Chief of Trauma Surgery Dr. Michael Hawthorne stood rigid with anger. His white lab coat swayed slightly as he pointed toward the hallway outside the bay. "I gave you an order, Nurse Donovan." His voice echoed across the department. "You are off this case." The room remained silent. Claire looked at him for a long moment before quietly removing one glove. She folded it neatly, then the second. Without raising her voice, she nodded once. "Yes, doctor." She handed the gloves to another nurse. No argument, no protest, no attempt to defend herself. That silence somehow made the confrontation even louder. Behind Claire, staff exchanged uneasy glances. A respiratory therapist looked toward the floor. One of the residents shifted awkwardly. Nobody wanted to be caught watching. Dr. Hawthorne had a reputation. Brilliant, demanding, unforgiving. And when he believed someone had challenged his authority, he never forgot. The trauma pager sounded again. "Level 1 trauma." The automatic doors burst open. 38-year-old male. One paramedic shouted while steering the stretcher inside. High-speed rollover collision. Driver trapped approximately 20 minutes. Significant blunt chest trauma. Blood pressure 84/52. Heart rate 140. Oxygen saturation 88 despite high-flow oxygen. The entire trauma team snapped into motion. Claire stepped aside exactly as ordered. Another nurse immediately moved into her position. Dr. Hawthorne leaned over the patient. "Airway? Patent. Breathing? Rapid. Circulation? We've got 2 large-bore IVs running." The patient groaned weakly beneath the oxygen mask. His chest rose unevenly. Blood stained the left side of his shirt where paramedics had already cut away part of the fabric. A portable ultrasound machine rolled into position. Chest X-ray. Type and cross. Prepare for possible chest tube. Orders flew across the room with practiced precision. Claire stood quietly just outside the trauma zone. Technically, she was no longer part of the case, but years in emergency medicine had trained her eyes to keep working even when her hands couldn't. She watched, not the monitors, not the X-ray, the patient. His breathing, his neck, his skin. Something tugged at the back of her mind. Not enough to interrupt, not yet. Inside the bay, Dr. Hawthorne examined the patient's chest. Decreased breath sounds on the left. He glanced toward the portable X-ray technician. "This looks like a tension pneumothorax." Several residents nodded immediately. One began opening the chest tube tray. Claire's eyes narrowed almost imperceptibly. The diagnosis made sense. It was exactly what most trauma surgeons would suspect. But something didn't fit. She looked again. The patient's neck veins appeared unusually full. His pulse weakened with each breath. His chest injury was serious, yet his trachea was not significantly deviated. The ultrasound technician hesitated. "Doctor." "I know what I'm looking at," Hawthorne replied without lifting his eyes. Claire remained silent. She'd seen enough trauma cases to know the danger of speaking too soon. If she was wrong, interrupting would only create confusion. She continued watching. A young resident whispered beside another nurse, "I've never seen Dr. Hawthorne this angry." The nurse answered quietly. 3 days ago, Claire corrected one of his medication orders during a trauma review. The resident frowned. She corrected the chief? She corrected the chart. What happened? She was right. The resident blinked, and every resident in the room saw it. Across the bay, Hawthorne reached for sterile gloves. "Chest tube now." Claire finally spoke. Her voice was so calm it almost disappeared beneath the monitor alarms. "Doctor." He didn't look up. "I believe we should pause one moment." The room froze again. Every pair of eyes shifted toward her. Dr. Hawthorne slowly turned. His expression hardened. "I don't remember asking for your opinion." Claire met his gaze without emotion. "I may be mistaken." She chose every word carefully. "But I'm concerned there may be another explanation." A heartbeat of silence. Then Hawthorne stepped closer. Concern noted. His voice dropped lower and ignored. He pointed toward the exit again. "I said, get out of my trauma bay." Claire looked once more at the patient. Then she quietly nodded. "Yes, doctor." She turned toward the hallway. As the automatic doors slid open behind her, a sharp, unfamiliar change echoed from the cardiac monitor. Beep, beep, beep. Claire stopped walking. Behind her, no one in the trauma bay moved. The shrill tone from the cardiac monitor sliced through the silence. Every head turned toward the screen. The patient's blood pressure dropped again. 80/40. The monitor chimed another warning. Heart rate 152. The respiratory therapist looked up. "Doctor, pressure's falling." Dr. Michael Hawthorne didn't hesitate. Chest tube. The surgical tray was already open. A resident handed him the scalpel. Claire remained just outside the trauma bay doorway. She had already been dismissed. Hospital policy was clear. Once relieved from a case, another nurse assumed responsibility. She should have kept walking. Instead, she stood perfectly still. Not because she wanted to disobey, because something still didn't make sense. The patient wasn't responding the way she expected. A trenchal pneumothorax usually announced itself loudly. The trachea shifted. One side of the chest stopped expanding. The decompression almost always produced an immediate release of trapped air. This patient didn't fit the pattern. Inside the trauma bay, Hawthorne made the incision. The residents leaned forward. One whispered quietly, "Here it comes." The chest tube slid into position. Everyone waited. Nothing. No dramatic rush of trapped air, no dramatic improvement. The monitor continued its relentless warning. Blood pressure, 74/38. The room grew noticeably quieter. A second resident frowned. "I thought." "So did I," another whispered. Hawthorne ignored them. "Increase fluids, prepare blood." The trauma nurse hanging fresh IV bags moved quickly. Another resident studied the ultrasound screen again. His expression slowly changed. "Doctor?" "What?" "I'm seeing." He hesitated. "There's fluid around the heart." Hawthorne barely glanced at the monitor. Probably artifact. The resident swallowed. "It doesn't look like artifact." Claire quietly closed her eyes for half a second. There it was, the clue. Not luck, not instinct, observation. She stepped one step closer to the doorway. "Doctor." Hawthorne turned sharply. "I thought I gave you a very clear instruction." "You did. Then leave." Claire nodded. "I will." She looked once toward the patient. "I only wanted to mention that his neck veins have remained distended since arrival." No response. "And?" The chest tube didn't improve his pressure. Still nothing. The ultrasound may not be showing artifact. One of the residents looked between them. Nobody spoke. Hawthorne's patience finally snapped. "I have been managing trauma patients for 23 years. His voice echoed through the bay. "I don't need a lecture from someone standing in the hallway." Claire didn't react. "I wasn't giving one." "Then stop interrupting." The room became painfully still. One young intern stared at the floor. Another nurse subtly shook her head. Everyone could feel it. This wasn't about medicine anymore. This was about pride. Claire inhaled quietly. "I understand." She turned away. This time, she actually walked. Past Trauma Bay 3, past the medication station, past the nurse's desk. Her footsteps were calm, measured, unhurried. Behind her, the trauma bay exploded into motion. "Pressure's dropping, 68 systolic, we're losing him." The monitor alarms intensified. The respiratory therapist adjusted the oxygen. Another nurse reached for vasopressors. Nothing stabilized. Inside the bay, Hawthorne stared at the ultrasound one more time. His confidence began to crack. Not because someone challenged him, because the patient wasn't following the diagnosis. His eyes moved across the screen, then back to the patient's face, then back to the neck veins. For the first time, he stopped giving orders. The silence lasted barely 2 seconds, but everyone noticed. One resident looked again at the ultrasound. This time, he spoke with more confidence. "Doctor, I think that's a pericardial effusion." Another resident leaned closer. "Oh, I see it now." The respiratory therapist slowly looked toward the hallway. Claire was already halfway to the elevators. One nurse whispered, almost to herself, "She saw it." Nobody answered. Across the room, Hawthorne stared at the ultrasound image. His jaw tightened. He replayed the last 3 minutes in his head. Distended neck veins, falling pressure, no improvement after chest tube, fluids surrounding the heart. The diagnosis he had dismissed began assembling itself piece by piece. Cardiac tamponade. The realization hit him like ice water. He looked toward the open doorway. Claire was gone. The monitor screamed again. Beep, beep, beep. The patient's blood pressure disappeared from the screen. "Doctor, we've lost a pulse." The trauma bay erupted. "Start compressions. Beginning CPR. Epinephrine ready." Residents rushed into position. The room that had been so certain moments earlier was suddenly fighting for every second. Hawthorne looked toward the hallway one last time, then quietly said something no one expected. "Find Nurse Donovan." The entire trauma team looked up. No one moved immediately. Not because they hadn't heard him, because they had. The same surgeon who had thrown her out only minutes earlier was asking her back. The trauma bay erupted into controlled chaos. "Starting compressions. Time of arrest, 3:47 p.m. Epinephrine ready." A resident climbed onto the step stool and began firm, rhythmic chest compressions. Another squeezed the bag valve mask while the respiratory therapist confirmed the endotracheal tube remained secure. The cardiac monitor displayed a thin, lifeless rhythm. Not completely flat, but close enough to make every second count. Dr. Michael Hawthorne stood frozen for the briefest moment. His eyes remained fixed on the ultrasound screen. The dark ring of fluid surrounding the patient's heart seemed impossible to ignore now. It hadn't appeared suddenly. It had been there all along. He simply hadn't believed it. His voice cut through the room. "Stop compressions." The resident hesitated. "Doctor?" "Stop." The compressions ceased. The room fell into an uneasy silence. Hawthorne stepped to the bedside and picked up the ultrasound probe himself. He moved it deliberately beneath the patient's sternum. This time, no one spoke. The image filled the monitor. The heart struggled to contract. Each beat looked weaker than the last. Around it, a large, dark collection of fluid pressed inward like a tightening fist. One of the senior residents whispered under his breath, "My God." Another swallowed hard. "That's tamponade." Nobody corrected him because everyone could see it now. Hawthorne lowered the probe. His shoulders stiffened. I was wrong. The words were barely above a whisper, yet they carried through the entire room. No one looked at him. No one judged him. There wasn't time. He turned sharply. "Where's Donovan?" A young nurse answered immediately. "She left the bay." "I know that." His voice remained controlled. "Find her." The nurse hurried into the hallway. Claire Donovan had reached the staff lounge corridor when she heard rapid footsteps behind her. "Claire!" She turned. Nurse Emily Foster slowed to catch her breath. "The chief wants you back." Claire looked surprised. "I thought I was relieved." Emily nodded. "You were. What changed?" Emily hesitated. "I think," she glanced toward the trauma bay, "he saw what you saw." Claire remained silent for a moment. Then she turned and walked back without another question. Not quickly, not dramatically, just with the same steady pace she always carried. As they approached Trauma Bay 3, the atmosphere had completely changed. Nobody was talking over one another anymore. The confidence that had filled the room earlier had vanished. Residents studied monitors instead of each other. The respiratory therapist adjusted equipment in silence. Even the paramedics who had remained to complete paperwork watched through the doorway. Claire stopped just inside the entrance. She didn't step into the treatment area. She waited. Hawthorne looked at her. For the first time that afternoon, there was no anger in his expression, only urgency. "Nurse Donovan." "Doctor." He held her gaze for a second. "What did you see?" Claire answered without hesitation. The diagnosis didn't match the patient. Several residents instinctively moved closer. She continued. The decreased breath sounds suggested a pneumothorax. She nodded toward the chest tube. That was a reasonable concern. No accusation, no criticism, just facts. But his neck veins remained distended. She pointed toward the monitor. His blood pressure kept falling despite fluids. She looked briefly at the ultrasound, and when the chest tube produced almost no release of air, she paused. I became more concerned that pressure was building around the heart instead of the lung. One of the senior residents quietly murmured, "Beck's triad." Claire gave a slight nod. Not complete, but enough to make me pause. Another resident frowned. "You noticed all of that while standing outside the room?" Claire answered honestly. "I noticed it while standing beside the patient." Silence. The distinction landed heavily. She hadn't solved a puzzle. She had simply never stopped observing. Hawthorne looked back at the ultrasound. Estimated volume. Claire studied the screen for only a second. Enough to prevent effective cardiac filling. The senior resident looked at Hawthorne. If that's correct, he needs immediate pericardiocentesis. Another resident added quietly, or an emergency thoracotomy. The room waited. Every eye turned toward the chief. Hawthorne inhaled slowly. Then his voice regained its familiar authority. "Prepare for emergency pericardiocentesis." The team exploded back into motion. "Ultrasound guidance, pericardiocentesis tray, 18-gauge spinal needle, sterile prep." Within seconds, equipment surrounded the bed. Claire automatically moved toward the ultrasound machine. She adjusted the monitor angle so Hawthorne could maintain a clear view while keeping the needle aligned. Neither of them spoke. They didn't need to. Years of trauma care had replaced conversation with instinct. The patient's blood pressure was now unreadable. The ECG showed electrical activity, but the pulse remained absent. The room held its breath. Hawthorne positioned the needle. Ultrasound. Claire steadied the probe. "You're approaching the pericardial space." "Angle?" 5 degrees left." He adjusted. "Advance slowly." A bead of sweat rolled down the chief surgeon's temple. Nobody dared interrupt. Another millimeter. Another. Then, Claire spoke quietly. "Stop." The room froze. She looked at the syringe attached to the needle. "I think we're there." Hawthorne gently pulled back on the plunger. For half a second, nothing.
Then, dark blood slowly filled the syringe. Unlike blood drawn from a vein, it flowed sluggishly, almost black under the operating lights. Claire's eyes never left the monitor. "That's pericardial blood." Hawthorne nodded once. "Place the catheter." The next 30 seconds would determine whether the patient lived or whether the trauma bay had already lost him.
The entire trauma bay stood motionless. Every pair of eyes was fixed on the syringe in Dr. Michael Hawthorne's hand. Dark blood slowly filled it. Claire Donovan kept the ultrasound probe perfectly steady. "You're in the pericardial sac," she said calmly. "Advance the catheter." Hawthorne gave a slight nod. His movements became slower, more deliberate. Years of experience guided his hands, but this time his confidence wasn't driven by pride. It was driven by precision. The catheter slid into place. Needle out. Claire watched the ultrasound screen. The catheter's stable. Hawthorne connected the drainage syringe. "Let's relieve the pressure." He gently withdrew the plunger. 30 milliliters, then 60, then 90. Dark blood flowed steadily into the collection syringe. No one spoke. Every heartbeat in the room seemed synchronized with the cardiac monitor. Suddenly, beep, a stronger electrical complex appeared. The respiratory therapist looked at the monitor. "We've got electrical improvement." Another 10 milliliters drained. The arterial line flickered. Then a number appeared. "Blood pressure, 68/40. "It's coming back," one resident whispered. Another round of drainage. The monitor changed again. 78/46. The pulse oximeter, silent moments before, found a waveform. "We have a pulse!" The announcement echoed through the trauma bay. Nobody celebrated. Not yet. Claire studied the ultrasound. "The right ventricle is expanding." Hawthorne looked at the screen. The heart no longer appeared trapped inside a tightening ring of fluid. Each contraction grew stronger. "Continue monitoring." Another resident checked the blood pressure. 92/58. A nurse smiled instinctively before catching herself. The patient took a shallow, spontaneous breath against the ventilator. The respiratory therapist was relieved. "He's perfusing." The room slowly exhaled. For nearly a minute, no one said anything. The only sounds were the steady rhythm of the monitor and the quiet hum of medical equipment. Life had returned to the room, one beat at a time. The crisis was over. The patient was prepared for transport to the operating room for definitive repair of the cardiac injury. As the transport team wheeled the stretcher toward the elevators, several residents remained standing in stunned silence. One of the interns finally spoke. "I thought we were treating a collapsed lung." The senior resident answered quietly. "So did most of us." He glanced towards Claire. She didn't. Another resident frowned. "How?" The senior resident shook his head. "She never chased the diagnosis." "What do you mean?" "She kept watching the patient." The words lingered. Watching the patient. Not defending an opinion, not winning an argument, simply observing. The trauma bay gradually returned to its usual rhythm. Blood-stained linens were removed. Fresh supplies replaced used instruments. Environmental services quietly entered to begin cleaning. The adrenaline that had fueled everyone minutes earlier slowly faded. Claire removed her gloves. She disposed of them in the biohazard container. Without waiting for recognition, she began restocking medication drawers that had been emptied during the resuscitation. A first-year resident approached cautiously. "Nurse Donovan?" Claire looked up. "Yes?" He hesitated. "I wanted to thank you." She smiled politely. "You don't need to thank me. You saved him." Claire gently shook her head. "No." She looked toward the now empty trauma bay. "The entire team saved him." The resident frowned. "But if Dr. Hawthorne hadn't recognized the new diagnosis immediately,
the outcome would have been very different. Claire closed the medication drawer. Trauma care is never one person. The resident absorbed the lesson in silence. A few minutes later, Dr. Hawthorne stepped out of the physician workroom. The bustling emergency department seemed quieter now. Nurses moved between rooms. Monitors chimed in distant hallways. Visitors spoke softly near the waiting area. He spotted Claire organizing supplies at the central nursing station. For a moment, he simply watched. Earlier that afternoon, he had seen only a nurse questioning his judgment. Now he remembered something else. 3 days earlier, the medication review. Claire hadn't corrected him to embarrass him. She had corrected the chart because the patient record mattered, just as today's patient mattered. He walked toward her. Several staff members noticed. Conversations softened. Claire looked up as he stopped beside the desk. "Donovan?" "Doctor?" There was no audience now, no trauma alarms, no emergency. Just two professionals standing in the middle of an ordinary hallway. Hawthorne folded his arms. "I owe you an apology." The word surprised nearly everyone within earshot.
I allowed a personal disagreement to affect my judgment. Claire remained quiet. I shouldn't have removed you from the case. She answered with the same calm voice she had used all afternoon. The patient survived. Yes, but that doesn't excuse my behavior. A long silence settled between them. Finally, Hawthorne spoke again. Next time, he paused. Don't leave the room. Claire met his eyes. For the first time, the corners of her mouth lifted into the faintest hint of a smile. Then don't ask me to. For a heartbeat, neither of them moved. Then something unexpected happened. Not applause, not cheering, not dramatic music. Dr. Hawthorne gave a single, almost imperceptible nod. It was the kind of nod one professional gives another when respect has finally replaced assumption. He turned and walked back toward surgery. Claire picked up another box of IV tubing and continued restocking the trauma bay. Within minutes, another ambulance radio call echoed through the emergency department. Community Memorial Hospital, this is Medic 12. Claire slipped on a fresh pair of blue gloves. Another patient needed help. The last argument had already become yesterday's news, because in trauma medicine, no one gets the luxury of living in the past. The automatic doors slid open. The next emergency rolled in, and Claire Donovan was already walking toward it.